Bob asked me if I could ask the first question, so I got lots, but I'll see if any of the others have a chance to come up. But if you look around the country, a lot of the fiscal pressure seems to be shifting and getting worse at the local level right now.
Yeah.
And one of the things driving it is rising pension costs and rising retiree health costs, because local governments tend to have far more workers than state governments. And the Empire Center, of course, did a report where they estimated that pension costs, contributions for New York's local governments would rise very dramatically. I think for the teachers fund, it was probably close to a quadrupling over 4 years, and somewhat less for the state and local retirement system, which at the time had an amortization available that the teachers did not. I was wondering if you could talk a little bit about what you see as the local government fiscal outlook. Do we have significant problems that cities or school districts may be facing, and is there a monitoring or oversight mechanism in place, and kind of how you see that placing pressure either on the state budget or on taxpayers?
Yeah, it's a great question. We are very cognizant of what we do and what impact it potentially has on local governments. Again, one of the things the governor, I think, talked about 2 weeks ago, and I think will be coming forward with very soon, is a new proposal on pensions. We're up to tier 6 now, I think. So I think one of the longer-term solutions to this problem, and ultimately it is a long-term solution, is to kind of get our pensions more in line with fiscal realities for public sector workers. So I think the governor will be proposing tier 6 legislation that extends out, I think, over the longer term to provide significant savings both to the state and to local governments. So that's one. Two, I think one of the reasons we tried to do the things we did with school aid especially was to say, look, we understand that, formula-driven school aids driving 9 and 10% increases into the out years, which to a certain extent are picking up a lot of your fixed costs at the local level, at the school district level. But, it's just not fiscal reality anymore. So let's give you something we think you can work with, and some insurance that will give you something consistent with what we can generate in revenue on an economically sustainable basis, which is why we went to personal income growth on school aid, which we think, again, once we get past this period we're in, I think gives schools, a reasonable, some reasonable financial security over time, as they also try to bring down those costs. And then, we continue to be interested in the SAGE kind of stuff, of where are there economies at the local level that we can help them, achieve reductions in bureaucracy and other things that we think are significant. We have the school aid folks here, so, they know this better than me. We have close to 700 districts. We have separate transportation, we have separate payroll, we have separate superintendents. We have all of those kinds of overhead costs that we think we have to kind of drive that as costs out of the system to try to save money, which then leaves a little bit of room to pick up those other things you're talking about. And then I think longer term we do need more mandate relief, and the governor has a mandate relief commission which is looking for ways to kind of find savings that we are not imposing our will as much on local government, so they have a little bit of room, more room to find savings and get out from under mandate. So I think we're thinking about it a lot in all of those different areas. So I don't answer this question.
Let me follow up on that, Bob, if I could. You, under the legislation enacted, I think, last year or the year before, the state is planning to take over local Medicaid administration. Is there anything that you can tell us about what you see happening with that, and are there other you did touch on this, but are there other areas perhaps that are as significant as that, where the state might look to some new arrangements of state and local responsibilities?
Yeah, I think, well, as far as SAGE is concerned, I think everything's on the table in terms of some joint local kind of ways to find savings. But look, Medicaid, I think we're one of maybe the only state who has a local component. I think some other states have a form of a local component, but nothing like New York. So we have been working on how we do the admin part, but even something as simple, you would think, as taking over the admin of Medicaid is very, very complicated. And the problem is it differs from locality to locality. And when you spend 60% of your Medicaid dollars in New York City, would you get rid of the New York City infrastructure, for example, that's built up and is fairly efficient in kind of handling that kind of admin? How do you do these kinds of things? These are the things I think SAGE is working on in coordination with the agencies to make sure that we have kind of a thoughtful way to try to get to some of these savings we know are out there. The governor is a big proponent of local consolidation, as you know, when he was Attorney General. We continue to look at all kind of possibilities for, kind of consolidation of government, school districts, whatever. But I think we're thinking, look, we know the politics of consolidation can be difficult, for example, at the school district level. But that doesn't mean that there aren't other shared services, things we could do in a much bigger way than we do them now. In terms of transportation, in terms of, back office functions, in terms of procurement, in terms of technology, all of those kinds of things we're looking at very closely to see where we can work with local governments to kind of find savings and do consolidations that make sense.
Let me go up to the federal level, if I could sort of follow up on that. Obviously, there's a lot of discussion in Washington about potential changes to the federal budget, many of which could have significant impacts on states, whether it's Medicaid block grants, for instance, or others. Can you talk a little bit about which of those possibilities you see as holding some promise of being beneficial to the state and which are scariest from your perspective?
Well, a lot scares me. I think in healthcare there really have to be some kind of changes, and I think one of the things we'll be exploring is, the possibility for waivers from the federal government on. Again, I'm not a healthcare expert, but one of the things that we are in New York State is, and I hate this term, but we're a do-gooder state, I think, in healthcare terms, right? We provide coverage under our Medicaid program for lots of folks that most states don't provide coverage for. Under national healthcare reform, a lot of those folks will now come into the system, okay? And the federal government's providing a big discount to states to provide that coverage that we have always provided at an expense, at a pretty expensive cost to us. So our view is there should be some room, since we've already kind of gone along towards this, to get significant benefit from the federal government, to get that same discount other states are getting, and to get it now because we're already providing coverage to those individuals they want to cover. So we think there's opportunities for us to make the case to the federal government that because what we're doing is already consistent with national health care reform, that, and we're following other programs like I talked about before, getting more people into managed care and out of fee-for-service, which is also a major element in federal health care reform, that because we're on the cutting edge there, because we're already covering people that they want covered, that they should be providing a bigger chunk of money for us to make sure it's successful. So we'll see what happens, but I think that's going to be a big effort next year. We also need a lot of, the other piece, I think, that is critical for all states, not just New York, but it's one that I've been worrying about a lot recently, is our transportation infrastructure. We have significant infrastructure issues like every other state, especially states in the Northeast. We have an aging transportation infrastructure. We have significant repair and maintenance we have to do. Forget about getting, new projects done. And we think the states, given their fiscal condition right now, are really not in a position to go out and embark on infrastructure programs that are absolutely necessary for economic development. So that's another area where I think we really think we need help from the feds.
I'll ask one more quick question related to healthcare reform. And some of the early estimates from Council of Economic Advisors and some of the Lewin Group studies were generating expected savings for states from no longer having to pay for uncompensated care, or at least not having to pay much of it. Do you expect that, in fact, New York will benefit in that way by no longer providing much in the way of uncompensated care?
We had estimates, and I'm looking to our healthcare people who are in the back of the room. We had estimates, I think, at one time that were very significant, but as we've looked at the details, we've kind of dialed it down a little bit. And that's what I was kind of getting at before. But I think, yeah, we will, I think, once fully phased in 2016, 2017, we probably will see significant savings somewhere in the neighborhood of $700 billion. 700 million.